much. We're just going to get started, and I want to introduce Tall Small Productions, who has partnered with
I like that.
We brought her along.
Did too. Yes.
I'm the mascot.
Yes, we love HCAM mascots. And we are really excited to have them here today. They're going to kick us off. We're Rebecca Klein-Scott and Keith Scott, and we are excited to have you here.
Thank you.
Turn it over to you real quick.
We would love all of you to take a step away from the person next to you.
Not because you don't like them
Not because you
anymore.
don't like them, but we don't want you to hit them.
You're thinking, I thought this was a friendly event, but here's the deal, right? You've got to be able to take your arm, point it out like this, and you've got to be able to move it around you. Now, if you hit somebody upside the head, then you need to move.
Okay. We're going to do this without any accidents.
All right. Is everybody good?
Yes.
Everybody ready?
Yes.
You are going to take one finger and point it straight out.
All right. Everybody point it straight out. Everybody got that? This is a smarter group than most.
Much smarter.
Much smarter group.
We'll point at you till you point back. Okay.
Now what you're going to do is you're going to take this finger in this arm, you're going to go clockwise all the way around till you feel comfortable, then stop and remember what you are pointing at. Got it? All right, so go all the way around, stop when you're comfortable, and remember what you're
your
pointing.
spot.
Everybody got it? Yeah. All right, come back to center.
Now the toughest part of all of this. All of the instructions
You
from
can drop
this
your
point
hands.
forward, drop your hand, will be done in your imagination only.
And there's always somebody that keeps on doing it, let me tell you. Here's what you're going to do. You're going to shut your eyes. All right, everybody shut your eyes. We're going to have someone go around and get your wallets. No, I'm kidding. That's how we make money here today. Now shut your eyes, and we're going to do this in our minds.
In your imagination, you are going to point your finger out again, straight ahead, only in your imagination for those people that are up.
Just for the people with their eyes shut, 4 people raised their hands.
We'll send you back to kindergarten. In your imagination, what are they going to do?
They are going to raise their arms, point their fingers, and this time you are going to take your arm and you're going to, in your imagination, go clockwise, but you're going to go 25%
further than your last limit. You're going to feel that stretch and take it 25% further. And if you're not a mathematician, it's a little bit further.
Just a little further. All right, this time in your imagination, come back to center, raise your arm, point your finger, and this time you're going to go clockwise, but you're going to go 50% further.
Past your first limit, past your second, a full 50%.
You never thought
further.
you could go this far, but you have now taken it 50%.
Wow. Wow.
Oh, I like that wow. Whoever said
You can do
that
that a
was
little
good.
louder, Lisa.
All right, this time come back to center in your imagination. The last time, but man, you're going to take it up a notch this time.
You're going to put your finger out, and like those cartoon owls that spin all the way around, you are going a full 360 past every single limit.
Wow. Every single limit. You've blown past them. 25%, 50%. You have gone all the way around. All right, quickly now. Open your eyes. Raise your arm. Point your finger. Everybody do it real quickly.
And go as far as you can.
Ready? 1, 2, 3. Go as far as you can.
You can say that louder.
How many people, raise your hands, how many people went further than before? How many people didn't? All right, good.
We have remedial classes for that.
Somebody shouted out, why did you go further? What happened?
Inspiration.
Vision did.
I was
Inspiration.
inspired.
Positive
Yes.
thinking, and that is what we have been incredibly impressed with in our work with HCAM. Everybody has an infinite vision for what can be accomplished.
And everybody, if you look behind us, has created that access. They've given us the access to help create the vision, but the vision here is amazing. And Rebecca and I have been blessed to meet and work with almost everybody here, and to feel their energy, because they took that vision not just here, but like another 5 years, another 10 years. Where are we going? And that's why you're in this amazing facility now.
And we can't wait to see where it goes next, what we'll be saying 10, 15 years from now, because the opportunities are endless. Turn it back to you, Josie.
All right.
So welcome. One of my favorite movie quotes, or one of my father's favorite movie quotes, let me just be honest, is from The Field of Dreams, if you build it, he will come, or she, or him, or her, or they. So welcome, we are privileged that you're joining us today for our partner open house. As we welcome you to see our grand opening, as well as the congressman who is joining us as I speak. We'll wait for him to join us. Good morning, Congressman.
Reminds me of a surprise birthday party.
We do have cake,
Oh,
so.
great.
Congressman, we are happy to bring a chair over for you if you would like that.
I'm ready.
I joined HCAM 18 and a half years ago as a perinatal family planning liaison and ombudsman with the responsibility of outreaching pregnant and postpartum women across Baltimore City. And as you can imagine, this was a very, very hard job and challenging. A job that taught me about food insecurity, about housing challenges, behavioral health issues, and that just touched the surface that our clients are met with each and every day, and a job that our team members help to solve and support each day. Over 200 HCAM staff members engage 145,000 individuals and families a year. We meet clients on the street, in hospitals, in community health centers, and in their homes. We work with the hardest to engage, the most difficult to locate, and those dealing with multiple social issues that impact their day-to-day lives. Connecting individuals and families to health coverage and care is the core of what we do. And we are humbled and honored to walk with every person on this journey of health coverage and healthier living. As the current CEO for the past 2.5 years, this transition of our new space has truly been a team effort. Emotional. We love you. And our newest board member, who is like my biggest champion, who I just love, Lisa Phillips. It's important that our leadership team, to create an environment where clients and team members felt welcome, respected, and comfortable in our new home. Yes. Even though it's a little chilly, we're still working on the heat. I think we've accomplished that goal and so much more. We couldn't have done it without all of our partners. And hopefully today on your tour, for those that had it and for those that missed it, you can stay behind and we'll give you a little insight into the work today on our tour and speaking with our staff and our partners. I wanted to acknowledge our legislators in attendance today who, along with Congressman Cummings, support our mission, and we look forward to honoring him shortly. Renee Cohen is here from Senator Cardin's office, so thank you so much for always being such a great supporter. From Mayor Catherine Pugh's office, Pete Hammond was here and had to leave. I know Shantae Eldridge was also here from the mayor's office, and Terry Hickey was to join us. I'm not sure if he's made it as yet. Christine Griffin was here from the delegate Mary Washington's office, and I wasn't sure if there were any other delegates that were here joining us today. We also want to thank our donors who are here today that made it possible for this new space. The Harry and Jeanette Weinberg Foundation and France Merrick Foundation made it possible for us to have a very large IT transformation and make it possible for us to actually physically move. Our space today was sponsored by RCM&D, and I know they are in the room, as well as Golden Group, and another co-host, the Baltimore County Chamber of Commerce is here with us today. Thank you. As you walked around on your tour, you were able to see our space sponsorship, support from London Disability and London Eligibility. He's so wonderful that we had to have 2 signs for him. Hospital Support Services, DentaQuest that supported our children's play area. Bill McLennan, our current board chair, who couldn't join us today, but was a sponsor. Dr. Robert Atlas, he didn't really have a choice to be a sponsor. One of our previous board members. Anne Arundel Medical Center, Priority One, our staffing agency, Tri-Bridge Partners, United Healthcare Community State, and SCNH Group, Annie E. Casey Foundation, Hive, and our photographers who donated their gorgeous photos Josh Berry Photography, Mackenzie Elizabeth Photography, and Rare Bird Photography. I see her out there in the lobby, so please come in and join us. So if you build it, they will come. It is with great pleasure that I introduce Dr. Josh Sharfstein, who has been on this journey with us for a very long time, and we just won't let him jump off the train. He has to stay on. He served as the previous Baltimore City Health Commissioner, the Maryland Department of Health Secretary, the Deputy Commissioner for the Food and Drug Administration, and served for 3 years as HCAM's Board of Directors Chair. Josh continues to guide and support HCAM, and we're honored to have him here with us today. Join us.
So I think my job here is to introduce Congressman Cummings. Let me just say that when I started as the City Health Commissioner, healthcare access was not doing so well as an organization. It was really at the brink of extinction, and it required an enormous effort by the staff and by the city, and particularly by Kathy Westcoat, who took over, and Tracy Kodak, to turn it around from an organization that was just barely getting by into the organization that it is today, that supports so many different critical services in Baltimore as well as around the region. And it's just, you know, to have been there, to have seen that, to realize how much work went into building it is just such a, you know, amazing feeling to have seen that transformation. And Tracy, you know, you have been there every step of that way, and please join me in just thanking Tracy.
Yay.
It is just a special honor for me to introduce Congressman Cummings. And let me just say that Tracy called me and said, "We've got a great idea for a fundraiser. Josh, if you could name a part of our new building after yourself if you give us money." And I said, "Could I pay you to not name anything?" Not my interest. I said that if you want to do something, pick something that someone and something that people can just feel great about.
Yes.
And we both said at the same time,
Yes.
Congressman Cummings. I'm going to tell you 10 things about Congressman Cummings. He works on a great many issues in Congress with both Republican and Democratic colleagues. He's advanced the preservation of records, whistleblowing protections, the national infrastructure on the Transportation Committee, and many other topics. Number 7, he uses humor more effectively than any other member of Congress. And I will give you one. I could tell you many stories. I will just tell you one. When I first started as the health commissioner and I was extremely nervous, Congressman Cummings called me up and said, "Let's go out on Medicare Part D and tell people that there's prescription drug coverage available for older adults for the first time." And we set up a tour that we went on together. I was the health commissioner, he was the congressman, and I was very new to my job and very nervous. And we went to a senior center in Baltimore where everybody was eating dinner. I don't know if you remember this, but it was seared in my memory. I got up and I was just terrified, and I talked and literally nobody looked at me. You know, I tried to play it completely straight. I just said, "Look, this is this drug coverage, you can get it, everybody's just eating." And then I turned it over to Congressman Cummings, and he got up and he said, "What's for dinner?" Everybody looked up at him. And he goes, "I'm serious, I want to know what's for dinner." And someone said chicken. He goes, "Chicken? That looks pretty good. What else for dinner?" Someone said green beans. He goes, green beans. And what's that other stuff? He goes, "That's sweet potatoes." He goes, "Wow, that looks good." Nobody offered me any. In that moment, I mean, just people were mesmerized, and for everything that he said. It's a skill that people don't appreciate that he has, but there is no equal. Number 6 is the ranking member of the Government Oversight Committee, the ranking Democrat. He's one of the most important political leaders in our country today, standing up against Russian interference in our democracy, against child separation at the border, against corruption by presidential appointees, against intimidation of immigrants in the census, against Mar-a-Lago guests influencing veterans administration decisions, against using work requirements to throw people off Medicaid, against the censorship of government websites that tell people how to get health insurance, for drug treatment, for the truth about what happened in Puerto Rico, for voting rights, and for the rule of law. That is in the last 6 weeks alone.
I'm going to book you a vacation.
Yeah. needs to rest up before the election, because after the election, we're counting on you so much from him. Okay, number 5, he felt so passionately about the Affordable Care Act and the opportunity to give people health coverage that he said he got to the House chamber early that day just to make sure nothing happened, nothing interfered with his ability to vote for this historic legislation. Number 4, he is incredibly generous with his support of others. And you hear this from so many different people in the public or private sector. He is always encouraging. I had a discussion with his wife yesterday, who is a public health hero in her own right. She came and helped me teach a class at Johns Hopkins, and I was saying the thing that's most remarkable to me is his use of humor, and she said, it's because you're not paying attention to how deeply grateful he is to other people and how he brings people in with the way he talks about them, and she was right, as I'm sure she often is, but she's right, and everybody that I know who's ever worked with Congressman Cummings not only admires him, but feels his gratitude and feels his understanding of the work that they're doing. Number 3, when the going gets tough, he asks, how can I help? And people may remember in Maryland that the going got tough when we launched our first health insurance exchange. Very, very tough. And I fielded many calls at the time from understandably irate public officials wanting to know what happened. I fielded one call from a public official who asked, how can I help? And that was Congressman Cummings. And when the going got extremely tough, when it looked like we wouldn't be even given the chance to fix the health insurance exchange, and there was actually bizarre things that were happening that were, even though we were succeeding in fixing it, somebody might pull the plug on us. There was only one person that I could call. It was Congressman Cummings, and he intervened to make sure we had a chance to do that. And so the entire Maryland Insurance Exchange is around because of Congressman Cummings. Nice. Number 2, his passion for health and justice are so deeply genuine that it inspires those around him. His staff, his peers, and his community here in Baltimore all revere him. And number 1, there's nobody better to honor here at Healthcare Access Maryland, Congressman Cummings.
Good afternoon, everyone. Good afternoon, everyone.
Good afternoon.
It is certainly my honor and my privilege to be here. Is this the room? Is this the room? I just wanted to make sure this was a nice room. This is a nice room. But I appreciate it. First of all, let me say that I'm very honored to be here. Tracy, thank you for your passion. As I stood there, I'm an observer of life. And as I watched you get choked up, it said a lot about you.
Yes.
It said that this is your passion. And I want to thank you, because I know that the most effective people that I know are people who are passionate about what they do. You can never pay them enough because they're doing it 24/7. And to Josh, I want to thank you for your leadership and all you've done and continue to do for our great state and what you did for the city when you were commissioner. Thank you. And so and everybody who has anything to do with this, I'm honored. I just left an event for the University of Maryland, the Jock Initiative Center, where they've combined, they're now taking the resources of the University of Maryland, the Gallo Institute for Human Virology, and bringing them together to create a center where people can come for HIV/AIDS treatment and wraparound services. And I got a bit emotional while I was there, because Tracy, when you have been in politics as long as I have, 14 years in the state legislature and 21 going on 22 in the Congress, you begin to ask the question, how can I be most effective and efficient? Or have I been most effective and efficient with the time that I've been given on this earth? And when you lay in the hospital, as I did for 6 months over the last year, you really think about it. You really think about how you are being viewed and how you are getting your job done. Health access is so very, very important. When I was in the hospital, I had an opportunity to interview a lot of people. 6 months, and I mean, I tried to be Steve Harvey in there. So I was interviewing everybody, patients, doctors, nurses, physical therapists. But the moment that touched my life more than any other was when a lady was about to get out. And here I was feeling like I was in prison and she was getting out. So I said, so she said, I'm getting out tomorrow. I said, oh, Miss Mary, oh, that's wonderful, that's wonderful. She said, but I'm so sad, and then she began to cry. She said, when I came to Johns Hopkins, they had to give me the treatment, but now I'm worried about how I'm going to get the cure. How am I going to get the cure? What she was saying is that once she got out of the hospital, how was she going to afford the medicine? How was she going to have the follow-up? How was she going to find a caregiver? Now a lot of you are standing here thinking that you won't get sick. Let me tell you something. Have a plan for getting sick and needing somebody to go with you or to be there for you. And she couldn't figure it out, John. She was baffled as how am I going to do that? And I am convinced that our health care system is still in trouble. The Affordable Care Act, we came a long way. Unfortunately, the President administration has done everything in their power to cripple it. One of the first acts of our president was to sign an executive order aimed at the heart of our Affordable Care Act. But I've stopped by here to tell you that health care should not be a privilege. Health care is a right. Yes. Health care is a right. And a lot of people are saying, well, Cummings, I don't need insurance, I don't need health care. I'm young, I'm vibrant. I just have one bit of advice for you. Just keep on living. People were wondering why I am so concerned in fighting these efforts to take away the protections with regard to pre-existing conditions. Ladies and gentlemen, I would venture to guess, you don't have to raise your hands, but I would venture to guess that 95% of the people in this room have what insurance companies would consider a pre-existing condition. We got to fight that. We have to fight. I have people in my own family who could not get insurance before the Affordable Care Act because of breast cancer. Couldn't get insurance. And so we are a great country, but we need organizations like Healthcare Access to help us get the word out, to help people avail themselves to opportunities. What is an opportunity if you don't know about it? What's up with that? We are a better country than that. And so what you do here, and I don't want you to underestimate it, is what you do here is you bring life to life. What you do here is give people hope. I'll never forget when I went into my first operation, I had a heart valve replaced. And I went into the doctor and he said, I know you thought that you were coming in here for a death sentence, but he said, I got to tell you that we can now do this, and we can do it through your groin, and you're gonna be fine. I mean, I wanted to shout.
Yes.
I wanted to shout. But can you imagine if he had told me that and I couldn't get access to it?
Yeah.
I mean, think about it. Then you die. See, one of the things that is happening in this country is that we have what I consider an empathy deficit. When I listen to some of my colleagues in the Congress, they say, you know, don't worry about it, you'll be all right, with no insurance. Millions of people thrown off the insurance rolls. Governors throughout our country failing to take advantage of the Medicaid provisions under the Affordable Care Act. Do you know what that means? That means thousands of people die every year in their states. And they could have had insurance, they could have gotten treatment, but what? Because of some political stuff, they die. And if they don't die, they are crippled. And if they're crippled, what happens? Their families suffer. And so all I'm saying to you is we've got to keep up the fight. You all are on the front line of making people's lives better. And again, I think a lot of times, and when I was in the hospital, I did my little interviews, and one of the things I noticed, I interview everybody because I want to find out how they got into medicine. I'm always interested. Now, unless you're a son or daughter of a doctor, that was one category. They had relatives in the family. But 80% of the people that I interviewed, doctors, nurses, whatever, they say they got into medicine because of some health issue in their family. An aunt that died from AIDS, a father who suffered from lung cancer, a mother who died from breast cancer, and they wanted to make a difference. They wanted to feed their souls. And so that's what you're doing. You're feeding people's souls. Now, a lot of you will look at your paycheck at the end of the week, and you know, and you get to the Safeway, and you are some of those people that do the subtotal, and then you got to put stuff back and all that. Some of y'all, I guess some of y'all don't shop. I shop with coupons, and amen. And so you wonder, why am I here? Why am I doing this job? Well, I'm here to tell you and convince you that you are here for a reason and a season. There's a reason you're here. You are here to make a difference. You are here to bring that life to life. When my mom, who was only, who was a former sharecropper with a 4th grade education, every time we would pass the University of Maryland Hospital, Josh, she would point to the hospital and she said, there's a baby up there being born right now that's gonna save somebody. There's a baby up there being born right now who's gonna save somebody. And that's what it's all about. That's why our diversity is not our problem, it is our promise. And we have to continue to work together to lift up our nation and lift up healthcare. And so the idea that the son of sharecroppers, who spent his first 6 years in school in special ed, told he'd never be able to read or write, end up a Phi Beta Kappa, lawyer, member of the state legislature, member of the Congress where Putin and Trump have me on their Rolodex. I ain't happy about that now. That's not a good one. Amen. But it shows you the life you save. I get tired, and I'll close on this. I get tired of people talking about the oh, the immigrants, you know, we can't have that, we gotta lock our borders and all that. Okay, I understand you gotta have reasonable immigration policies. But the fact is that they don't tell the other story of all the wonderful people that have come here and made a difference. They don't tell the story about the 27 doctors who treated me at Johns Hopkins from different nationalities. 27 different nationalities treated me. So that's why I say our diversity is our promise. But don't be fooled. We need people like the Ben Cardins of the world, Sarbanes, Ruppersberger, Van Hollen. We've got a delegation, every one of us voted for this, the Affordable Care Act. Every one of us support you 1,000,000%. And I hope that you understand that your mission is great. As I close, you know, thank you for this room. My mother who died in '92 in February would be very proud. The last thing she said to me, her last words, is, baby, don't let them take our vote away. The last words she said before she died in '92. And so I'm gonna carry on. And don't get it twisted. Just because my leg is hurting doesn't mean my mind is clear. And just know I got your back. Oh, got a flag? Oh. Flag goes with the room. Hi.
Before you leave,
Okay.
we have something to make this room even more official.
Oh, wonderful.
Tracy?
Yes. So, it's pretty, right?
Yes, it's beautiful.
So, HCAM's boardroom is dedicated to the Honorable Representative Elijah E. Cummings for his tireless efforts in Congress to ensure all Marylanders have access to health care and critical health-related services.
Wow, thank you.
And we have to cut a ribbon.
Okay,
That's
right.
what you do.
No problem.
Okay. So we'd also like to have the Baltimore County Chamber of Commerce come up. Maybe Franklin, are you around here?
You want to do the next side or this side? Which time do you want to go?
We'll pull it over here.
Pull over here?
You can do your ribbon thing. If
You
they'd
know
like
what,
to join us.
it's interesting, this is a beautiful room, and I love that blue, that's my favorite color. Wow.
We moved a wall for you. There, it was much smaller. We decided it needed to be
Moving
bigger.
walls. That's our motto, move the wall.
And we're ready to go, so.
All right.
We want to thank, in honor of Elijah Cummings. This is a great room, and Healthcare Access does a great job of advocating for people that can't speak for themselves. And as he said, I'll echo the same sentiments. Healthcare is a right that all citizens of the United States need to have, and without organizations like this, a lot of people would not have access to those type of treatment and facilities that they need. So this is a great honor. In order to kind of cushion this room, we're going to cut this great ribbon here with these large scissors that are. All right. But can we get a great countdown? We're going to do a 1, 2, 3. Okay. All right. 1, 2, 3.
We are so honored to have the Congressman here, and in front of our gorgeous mosaic for access, put together by our leadership staff, and the creation of Metcalf Studios, and our board members. So I want to thank our board members that are here today, current and previous. And so thank you. We have food, which I know everyone is hungry, in the adjoining area. Please, if you have not had a tour of our space, please stay and take a tour of our gorgeous space. And thank you again to Congressman Cummings, and we're excited to have this room in your honor.
Thank you very much.